Hi, my name is Mariah and this is my video on tracheostomy care. For this video, I have already gathered some supplies that I'm going to need. These supplies are going to be a tracheostomy clean and care tray. I also have the cleaning solution as ordered. I have my hand sanitizer here ready to go. I have some clean gloves and I have some tape that I may need later. For tracheostomy care, I'm going to first obtain doctor's orders. I'm going to read over those and verify that the information is correct. I'm going to go to the patient and identify myself. I'm going to have the patient verify their name, their date of birth for me. I'm also going to check their wristband to assure that this is the correct patient. After I've introduced myself, provided privacy, I've hand washed at this point, I'm going to educate the patient and just let him know what the doctor has ordered. I'm going to get patient's consent. I will grab my supplies and I will perform. So at this time, I am going to hand wash. Going to introduce myself. Hi, my name is Mariah. I'm going to be your nurse today. I'm going to go ahead and close the curtain behind me and provide us some privacy. I'm going to ask you to verify your name and your date of birth. Patient's name is Alfredo Perez. I'm going to also verify the patient's wristband. I've verified now this is the correct patient. Hi Alfredo, I just want to let you know that I have received orders to clean and change your trach dressings and trach ties. Do you have any questions for me? So my patient at this time has indicated that they have no questions. I am going to put some gloves on and set up. So during this time, I will have already checked my patient's blood pressure, vital signs. I'm going to place a pulse oximeter on the patient's finger to monitor his saturation throughout the procedure. I'm going to go ahead and pre-oxygenate the patient for about 30 seconds to make sure that they have good oxygen airflow before we get started. Okay. So just with some regular clean gloves, I'm going to sit my patient upright, get him in a high Fowler's 30-degree angle, something that the patient is comfortable. At this time, I'm going to remove his previous split gauze. And I'm going to be gentle to ensure that I don't dislodge anything at his trach site. I will, once removed, I will take a look at the surrounding tissue for any redness, swelling, any indications of infection. At this time, I don't see any of that. I'm going to go ahead and take these gloves off. I'm going to wash my hands again, and I'm going to prep the rest of my supplies. So the next thing that I'm going to need for trach care is I'm going to need my tracheostomy clean and care tray. For this, I'm going to open away from me. So I will open away from the body. I'm going to place this down. So inside I have some sterile gloves. I'm going to move those to the side because I will use those at a later time. I am going to open up the sterile drape, and I'm going to make sure that I have the shiny side up, and I'm going to lay that across my patient's chest. Okay. The other items that are in my trach supplies kit, I'm going to empty here onto the tray, onto the drape. And I'm going to save this sterile tray here because I will be using it to pour my cleaning solution as ordered. Today's order, doctors ordered the tracheostomy site to be cleaned with normal saline. I have 3 chambers here, and I'm going to fill all 3. So here is my cleaning solution. I'm going to add cleaner here, cleaner here, cleaner here, and I'm going to put this to the side for a later time. Okay, my hands are still clean at this point. I'm going to open up my sterile gloves and apply those to get started. Okay. Okay, now I have my sterile gloves on. I will make sure that I don't bring them below my waist, as they would no longer be sterile. So I have my sterile field set up. I'm gonna just organize the items here so that way it makes the cleaning easier. So inside I have some pipe cleaners. I have some Q-tips here that I'll use to clean the stoma at a later time. I'm gonna place that in a clean soaking bin for later use. I have inside here some 4x4 dry dressings. Dry gauze pads. I'm gonna separate those. It has included a clean split gauze and new trach ties, along with a bristle brush that I will use to clean the inner cannula. Okay, Alfredo, I'm going to remove your inner cannula. I'm going to place it here in the bin and soak it. So I'm going to twist and unlock my patient's inner cannula. So after removing it, I'm going to place it in the soaking bin. I'm going to allow that to soak over some time. I am then going to use my brush to scrub the inner cannula. So in the solution, I will scrub it. We'll clean it. Now that I'm done with using this brush, we're not going to keep it. We are going to toss it right into the trash. Okay. Going to place the clean inner cannula into some soaking solution. After that has rinsed and soaked, I'm going to remove that and let it air dry. Once the inner cannula is air dried, it is ready to go back here to the tracheostomy site. So we will insert this and we'll make sure to turn or make sure that it goes in and we lock it in place. So now I know this is not going anywhere. Okay, after that I am going to get my sterile Q-tips that have cleaning solution. I'm going to clean around the patient's stoma site. So I'm going to start here on the patient's left side, and I'm going to clean around and out, and I'm going to toss it. I'm going to grab a new one. I'm going to clean around his stoma, around and out, and into the trash. I'm going to clean under the stoma site, lower neck here, and toss. And I have one more. We will clean around here. Here's the right side of his stoma, around and out, and we're gonna toss that. Okay, I'm gonna grab a 4x4 dry gauze, and I am going to dry around his stoma site. We are clean now. We are clean. I'm gonna ask my patient how he's doing. Hi Alfredo, you doing okay? Okay. Patient says he's okay. So I've cleaned around your stoma site. And now I've patted it dry. The next step is changing out your trach ties. So for this portion, I will need a second set of hands. So I'm going to have my coworker come in, clean their hands, and apply PPE. They are going to hold down the side of your trach dressing, or I'm sorry, your trach ties while I remove one side at a time. The reason that we use 2 persons to do this step is to prevent dislodgement of the tracheostomy. Okay, for this video, I will use my second hand to do that, but if this was a real scenario, I would have my second person come in and help me with this part. Okay, so at this time, I am going to lightly remove his trach ties by untying it. Okay. For this part, I will ask my patient if it's okay if he can lift his head for me. So patient will lift his head slightly so that way I can pull it out on the side. Okay. So we will apply pressure here and just assure that this does not become dislodged. Okay. Now we will put the old trach ties into the trash. I will, at this time, reapply his trach ties. And I am going to assure that when I tie this, I leave only and no more than about 2 finger space here. That's to make sure that we have the trach ties tight enough that it won't dislodge, but also loose enough that it doesn't cause the patient any skin integrity issues or skin breakdown. Okay, so I have tied a knot here on the tracheostomy and we will wrap this around. Okay, I'm going to ask my patient to go ahead and lean forward for me. Bring this around. Ask my patient, are you doing okay? Patient says he's doing okay. So I am almost done here. Going to tie these. And I'm going to assure that I have at least enough space for about 2 fingers here. Have good enough space. I'm going to assure on this side. I can also fit 2 fingers here on this side. I'm going to tie my patient's knot. And I'm going to double check here, 2 finger spaces here, and the dressing is not too tight. Next, I'm going to replace the split gauze around the patient's stomach. Okay. I have replaced the gauze. Because I had tied knots here to ensure that the patient doesn't get indentions on his neck because of those knots, I'm going to apply some a 4x4. We're going to fold that in half, tuck it and tape it, and we're not going to tape it onto the patient's skin, but we're just going to tape it so the edges of the gauze close over. So I'm going to do this side first. And apply a little tape. And there we go. We will tape that down. I have another 4x4. We're going to place this here around that knot. We're going to fold that down, and with another piece of tape, we are going to close the end there. Okay, so now we have completed tracheostomy care. I'm going to ask my patient if he has any questions for me. Hi Alfredo, I've completed our tracheostomy care. Do you have any questions for me? So my patient does not have any questions for me. I'm going to go ahead and clean up the items that I brought in and dispose of these in the trash. Before I go, I am going to ask my patient, is there anything else that I can get for you? My patient has said no. At this time, I have rechecked my patient's vital signs as well as rechecked that his oxygen levels are within normal limits. So my patient's vital signs are stable. The pulse ox is reading that he is in the high 90%. We have no respiratory issues. At this time, I'm going to go ahead and take my gloves off. I'm going to wash my hands. I'm going to return my patient to a comfortable position, or if he'd like to stay like that, that's also okay. I'm going to leave the call light within reach. I'm also going to bring his bedside table over closer to him as well as lower his bed. I'm going to push back the curtain and exit the room. I'm going to document my findings surrounding tissue and how the patient tolerated the procedure.